Our next guest, Clare Rowe, who's a Sydney-based child psychologist. Good to talk to you again, Clare. You would have just heard what Peter Collignon had to say about the medical side of it. There's very, very little medical benefit from preventing children and families going to playgrounds. From a psychological point of view, how damaging is it for locked down families in Melbourne not to even have that release of taking their kids to the playground?
Yeah, hi Chris. Good to join you again. I think, well, first of all, I think Professor Collignon then just took the words out of my mouth, really, didn't he? I mean, and as far as the medical side is concerned, the general public aren't being given that information to support that medical evidence and therefore policy decision to close playgrounds. And I think that is what is frustrating people, and there needs to be a little bit more transparency behind the reasoning as to how these decisions are made. We keep being told, particularly in Sydney, that transmission occurs in the household and in the workplace. Outside, we are told we are reasonably safe if we wear a mask and socially distance. So then it doesn't make sense to follow with some of these decisions. Now, I think in terms of a mental health perspective, who uses playgrounds? We're talking about young children, 1 to 4 year olds, preschoolers, toddlers. If we're talking about mental health, we're talking about the mental health of their parents here, okay? We are allowed to go out and exercise in family groups and take a walk. Well, I have a 3 and 4 year old, Chris, personally, and I can't tell them to come out and let's go for a nice power walk. It doesn't work like that with little kids. You need to take them to a playground to play on. And in my experience, I think, parents are very conscious of kind of keeping away from people. And I don't really myself in my local area, and I'm in one of the hotspot LGAs, I don't see playgrounds loaded with kids or, heavily used at the moment. There might be 1 or 2 with parents keeping away from each other. So I think when you're looking at mental health, you really don't get that concept until you are cooped up in a house with a 3 and 4 year old all day, every day, whilst you are trying to do your job. And I think that is a really important note to make. Parents are trying to keep their employer happy and entertain 3 and 4 year olds. It's just a recipe for disaster for their mental health. They need to get out and run these kids around, and I'm really concerned about it.
Yeah, well, I've heard about people in Victoria and people try and be sensible and they try and have a routine, and some are at home with 2 or 3 young children, and that one excursion a day to the playground, as we keep saying, with absolutely minimal medical risk unless you actually start hugging people, not only is great for the children, but of course for the parents. They might chat to other parents, they can be socially distanced. Tell us what your concerns are about how people and children in particular are coping with the lockdown pressures.
Oh, look, I'm very concerned, Chris. I mean, we haven't spoken much about that age group, and I think that this is a really important issue to take up. But what we have been talking about a lot is teenagers. And of course, that's what I'm seeing a lot of in my clinical practice in Sydney. And I'm not talking about teenagers feeling down. I'm talking about far more severe presentations than that. I know a lot of GPs are calling out to the government at the moment and are in contact with me about the levels of self-harming and suicidal ideation that we're seeing. So I'm just wondering how many suicides, how many self-harming incidents do we need? And of course, we can't put them down directly to lockdown, I understand that, but we can compare to last year's figures and the year before that and the year before that. How many, what is the rise that it will take on balance to look at COVID deaths versus the impact of mental health? So that's teenagers. But yes, look, if we come down to this particular issue with shutting playgrounds, I know New South Wales did it last year. I recall living in Sydney myself that we had playgrounds shut for that period of time last year. This year we have much bigger cases. We're not shutting it down. So again, I kind of come back to also to that inconsistency, arbitrary kind of rules. People are thinking, well, I want to know the reasoning why. Is it the children climbing all over the playground, grabbing onto it? Can I bring some alcohol swabs or wipes and do that? Is it the parents socialising and talking to each other? I'll keep apart. Because whatever it is, I'm sure there were ways around that. And I think that was summed up really nicely by Professor Collignon there, that saying that, if you do spread one infection in 600 that came from a playground, but you are grossly assisting, significantly assisting the mental health of parents with young children, then I think think that's worth it, because there is limits to what parents can take. There is limits to how much they can bribe their children to be quiet during the day while
Indeed.
they're on their own conference calls to say, don't worry, love, we'll go to the park at 3 o'clock. And take that away from them in that routine, and we could have disastrous results.
It is madness. Thanks so much for joining us, Claire. I appreciate it.
Thanks, Chris.